Okay, welcome everyone. My name is Kian Wong. I'm the head of the enrollments and marketing at Postural Orthodontics and the host for today's webinar, Introduction to Postural Orthodontics, how my brother's widgets, we affectionately call the Wong widget appliances, and why parents are investing and learning about early intervention, the importance of early intervention. 145 consecutively treated cases reveals the 7 steps to straighter teeth, beautiful faces, and better airways. We have a very special guest on today too, actually. We have Professor John New, the creator of orthotropics, who is joining us all the way from London. We've had some technical issues, so you won't be able to see him, but would hear his voice, so apologies in advance for that. And we also have Mr. Enrico Di Giovanni, the founder of A Point Dental Lab, who co-created the appliances with Dr. Simon Wong. Over the last 12, 13 years they've known each other. They've been working and perfecting these appliances, which you'll be learning all about in the next hour. So moving on. Quick thank you shout out to Dentarum Australia and A Point Dental Lab. Oh, and a quick update. We've just inserted this into the recorded webinar that you're watching right now. We're very excited to announce the upcoming 2-day intro to early intervention postural orthodontics for the first time ever in person in the East Coast of the US. In fact, on the September 27th, 28th, of September 2024 at the DoubleTree by Hilton Newark Airport in New Jersey, USA. It's just 7 minutes for Newark International Airport, 20-minute Uber ride to Midtown Manhattan. So very excited to have my brother fly over to this neck of the woods. We've got some amazing guest speakers as well from Dr. Amanda Wilson is flying over from Honolulu, Hawaii. She's an orthodontist and there's quite a big following on social media. Very excited to have her come over as well. We have Dr. Kevin Boyd, board-certified pediatric dentist, very well known and in the US as well. And Enrico Di Giovanni, the founder of A Point Dental Lab, who has worked very closely with Simon over the last 15 years or so. He'll be flying over from Australia in person, and the ENT specialist surgeon, Professor Narinder Singh, he'll be joining via live stream. He won't be able to fly over from Australia, but yes, this will be coming with full roughly 13 hours of CE credits via PACE program with the AGD. We'll be talking all about this at the near the end of the presentation, but you'll be able to, if you can't make it in person, also attend via live stream. So there are some live stream options. So right now, we're still at the super early bird specials at the moment. So yeah, we'll tell you a bit more about that later. Firstly, quick introduction to Dr. Simon Wong. He's the founder of Postural Orthodontics and a leading expert in facial growth guidance and early intervention. He's held the position of visiting professor, co-director of the orthotropics module at the University of Valencia, Department of Orthodontics, and is a fellow of the International Academy of Dental Facial Aesthetics. The past 13 plus years as the principal of the Clinic Natural Smile Center based in Melbourne, he's been focused full-time on the correction of early childhood craniofacial development issues, a devoted practitioner for the early correction of malocclusion. He's a published author with journal and textbook articles on sleep disordered breathing, with his most recent article, The Jaw Epidemic, Recognition, Origins, Cures, and Prevention, published in Bioscience 2020. His current clinical research at the Orthodontic Department of the University of Alberta, and most recently at Texas A&M, under the supervision of Dr. Peter Bushang, will hopefully provide the pathway for the future of orthodontics to be focused on cures and prevention for all oral facial development issues for our children. So please welcome Dr. Simon Wong. Simon, you there?
Yes. Hi. Thank you.
All right. So I'm going to pass it over to you so you can introduce folks. I've been over the last few years compiling my brother's, over 150 cases. So we've been submitting it for research, but we have I put together a very short 6-minute slide presentation. We won't show all 150, but a good few of them. And I'm going to pass it over to you, Simon, to bring it up. And then after the 6 minutes, you'll do your short half-an-hour presentation or so. All right, thanks. Over and out.
Thank you. So tonight we are going to go on a journey, an introduction to early intervention. We're going to explore some of the differences between postural orthodontics and other forms of early intervention. We will investigate the possibility of mandibular expansion and how we can create the mechanics behind this process. We'll look into the possibility of making early intervention a normal part of practice without focusing on the marketing and advertising. And we want to give you the opportunity to join us where we can talk in depth about my postural orthodontics. And we are very fortunate to have a guest, Professor John Mew, the creator of orthotropics and the leader of early intervention in the growth and development of facial beauty in our children. So my journey and the origins of postural orthodontics really came to light when I met John Mew about 15 years ago. And his book, The Cause and Cure of Malocclusion, changed my entire perspective on orthodontics. Fortunately, John has made online access of some of his chapters within this book to be available free. And I would encourage you to look at orthotropics.com in the shop and test drive this wonderful manuscript. The years before COVID were full of travel for me. And I was very fortunate to have the compliment of a friend and colleague, Enrico, who created with me the program that we will be sharing with you for the rest of this evening, and if you join us in July in Sydney. Over the years, I was very fortunate to have spent time being taught and mentored by very significant founders of the early intervention that is seen across many parts of the world today. I created a simple book for children to grasp the concepts that John taught me on oral posture, and Sandra Khan and myself created this instruction manual to help spread John Mew's work. About 10 years ago, I started to share some of this knowledge and created a program that helps clarify the role of posture and malocclusion. And, over the years, I've been very fortunate to share this knowledge with pediatric dentists around the world, orthodontists around the world. And I hope to share it with the general dental practitioners today, who really are the front line and the first point of contact for many of the children who need early intervention. One of the questions that I wanted to answer for people who were interested in this concept that I created, postural orthodontics, is how is it different to other forms of early intervention? One thing that I wanted to highlight was postural orthodontics works within the system of the standard of care of orthodontics. We use existing mechanics, proven products that have a history of not decades, but multiple decades. And we modified these to be useful in today's practice. We created appliances that could reopen spaces when early tooth loss created collapsing arches. We created appliances that could effectively expand the maxilla. And one of the things that I'll talk about today is the creation of an appliance that can effectively create mandibular arch expansion. We've been fortunate that a number of universities, the University of Valencia, University of Alberta, University of Texas, have been interested in the work that I have been undertaking in my practice. And we found that when we compared the treatment modalities between accepted functional appliances, we gained significant improvements relatively to the changes in sagittal dimension that were only barely possible, barely changed with traditional functional appliances. We were able to reduce vertical dimensions at a much greater rate when compared to functional appliances. The study at University of Alberta, the study at Texas A&M, they are opening the doorway for posture as a treatment modality to be made available and to be scrutinized so that we can have the opportunity to have peer review of the techniques that have been successful within our private practices. One of the leaders of the understanding of true mandibular rotation and growth mechanisms in children into their adulthood has been Professor Peter Bouchang. He has been the director at Texas A&M and a big part of Baylor College of Dentistry. What we have been very fortunate is his interest in orthotropics has provided an avenue of sharing John's work with the faculties of orthodontic research, hopefully around the world. The preliminary findings from our study have been very positive, and we hope to be able to share this in the near future. So tonight's focus is on mandibular expansion. And one of the points that I do want to help people understand is that there is a difference between the terminology mandibular expansion and mandibular arch expansion. We cannot forget the suture in the mandible fuses very, very early in a child's life. But we do have to remember that we can influence alveolar bone. And we have to remember that alveolar bone in an adult is not the same as alveolar bone in a teenager, and is not the same as an alveolar bone in a child. I want to be able to help you understand how we can create enormous change in the arch form of young children. I want you to understand that mandibular arch development is possible. And I want you to remember that mandibular arch development in dental alveolar bone of a 7-year-old encompasses 3/4 of the height of the mandible. We have to remember, where there are teeth, we can influence. And I can remind you with this X-ray that there are teeth in almost every segment of the mandible of a 7-year-old. And where there are teeth, there is influence in orthodontic postural appliances. These are not new concepts. O'Grady in 2006, in the AJODO, undertook a long-term evaluation of the mandibular Schwartz appliance and the acrylic splint expander in early mixed dentition patients. Removable mandibular expansion Schwartz significantly more favorable results than in RME-only protocols. When we have greater increases in the transverse width of the mandible arch and the mandible arch perimeter in the long term, following uprighting of the mandibular posterior teeth buccally, allows for an amount of maxillary expansion that was clinically effective. See, we can all expand the maxilla, but we forget the limit of our expansion of the maxilla is set by the mandibular arch form. Imagine how wide you can make the maxilla if you could create a wider mandibular arch form. McNamara in 2009, in the Seminars in Orthodontics, presented a 4-decade perspective on orthodontic and orthopedic expansion in the transverse dimensions. After 4 decades of research carried out at the University of Michigan, treatment effects produced by expansion in the late mixed and early permanent dentition and the early mixed dentition includes the lower Schwartz appliance. Expansion of the transverse dimensions has many indications. Constricted maxilla, as manifested by a narrow transpalatal width. Eliminate posterior crossbites, anterior crossbites, in conjunction with a facial mask, and improving tooth size, arch size discrepancies. Rapid maxillary expansion alone, or in combination with a removable lower Schwartz appliance, prove clinically significant increases in the available arch width, improvements in smile aesthetics, the creation of space to aid in the eruption of impacted canines or incisors, and enlarging the nasal airway. We have been exposed to the concept of mandibular arch dimensions for half a century. It's proven, it's effective, and it creates a much more favorable potential for maxillary expansion. One of the reasons why we no longer focus on this is because we've lumped all early intervention into the same category without really grasping that fixed appliance therapy in teenagers is hindered when we don't use early intervention opportunities. We need to highlight what is possible when we use knowledge and smart mechanics. We have the potential in a young child to create enormous change, permanent change, change that is extensive in the vertical dimensions of the entire mandible. We consistently when working with younger children, when using the appropriate appliances, create space, create beautiful arch forms that give the potential for matching the maxilla potential expansion and overcoming the limitations that we've always had, with the misinformed view that mandibular arch expansion is the same as mandibular expansion. And because we cannot expand the mandible, we can't change the mandibular arch form. We're all taught the rule. After the lower canines have erupted, we are set in our transverse dimensions. There is no point expanding further because the mandible will not take it and you'll push the teeth out of the bone. And I'm not here to disagree with that statement. But we have to remember the mandibular canines, the permanent canines, erupt between 10 and 11 years of age. If we operate at 4, 5, 6, 7, 8, 9, 10, before those canines erupt, do we not have the potential, if we understand physiology and anatomy, to change what is possible in creating beautiful mandibular arch forms that are stable because they set in pubertal bone hardening in a beautiful form? We have a tool and knowledge to use that tool. And I hope that you will let us share this with you in the upcoming program that we've created called Postural Orthodontics. I've been fortunate that I've had the opportunity to use techniques that have consistently provided beautiful outcomes. And I have been fortunate to have mentors help me over the hurdles. I hope now to pass that forward and to share with you in our 2-day introduction to postural orthodontics the shortcuts, the tips, the secrets of how to avoid all the pitfalls that I encountered in my journey over the last decade and a half. And I hope that you will join us so that I can share with you how you might impact the community around you with early intervention postural orthodontics. I want to share with you the evidence behind what I've been doing. I want to share with you the knowledge of the special guests that have agreed to pass on their knowledge. We have knowledge that needs to be verified. We want to achieve results that work, but we want to be able to explain it to our community, our profession, so that we stay within the boundaries of evidence-based dentistry. I hope that what we do in early intervention is recognized, because we'll be able to remind people that it is robustly evidence-based, and that everything we do is logical, sensible, and within the standard of care of orthodontics.
Okay, so we're once again very excited to announce our upcoming 2-day intro to early intervention postural orthodontics, a new evidence-based approach to early intervention orthodontics. Friday, Saturday, 27th to the 28th of September 2024, the Doubletree by Hilton Newark Airport. 145 consecutively treated cases reveals the 7 steps to straighter teeth, beautiful faces, and better airways. Now, join our mission-driven community of over 300 plus dentists who've already gone through this program. We have a private Facebook group you can join as well when you join this program. It comes with around 13 hours of CE credits, a PACE program with the AGD, some really amazing special guests who have already agreed to come visit us over here in the East Coast. We've got not only my brother flying over from Australia for the 2 days, he'll be the main presenter, but we also have guest speaker Dr. Amanda Wilson, orthodontist and the founder of Straight Smiles Solution. Many of you know her through her years of dedication to her training and coaching through Straight Smiles Solutions, amassing close to 30,000 subscribers on YouTube alone. Dr. Kevin Boyd, board certified pediatric dentist, who will be flying over as well. Professor Narinder Singh, ENT surgeon, based out of Sydney, Australia, clinical associate professor of surgery at the University of Sydney. He's actually one of the most well-known ENT surgeons in Australia. He'll be joining via Zoom, the live stream. And Mr. Enrico Di Giovanni, the founder of 8 Point Dental Lab, who's worked very closely with Simon to develop his appliances, he'll be flying over as well to New Jersey, New York area. You can see all the, it's a full 2 days. You can see the agenda there. There will be a dinner reception on the Friday night for those who join our VIP program. And you can see all the early bird specials here. At the Doubletree, there will be some fantastic rates. I think $159 a night. Just email us for the details, for the link. And yeah, it's a great location, just 7 minutes from the Newark International Airport, 20-minute Uber ride to Midtown Manhattan if you want to hang out there on the weekend as well. But you know, we've got some very interesting bonuses for the VIP premium ticket this year. We've got not only the dinner reception where you can you know, join the table and let us know who you'd like to sit with, whether it's Kevin Boyd, Amanda Wilson, or Dr. Wong. You know, first come, first served. There's roughly 10 seats to a table. Also, Dr. Wilson has very graciously offered a free case study review. If you can see here the a la carte special, it's a single 20-minute case review. Normally she charges $449. But that's included as well. It's only 20 for the first 20 folks who purchase the VIP ticket. And if you get the VIP, you get the event recordings as well for the entire event, as well as instant access to last year's event we did in Sydney, Australia, a 2-day event. The whole idea is to have you immerse yourself in this so that when you attend in person, you may have already gone through the recordings or part of it, and you know, get a much more immersive experience in person. Obviously, if you can't make it to New Jersey, then join our live stream. You know, it'll be live streamed, and that comes with the recordings as well. You can see we're still in this early bird phase. You can't even purchase tickets on our website. You just email us. if you want to be on the kind of the wait list, we'll be launching very, very shortly. We'll be offering the usual 50% discount on accompanying staff. So just email us if you're have a big team coming along as well. All right. So very excited to host this event and organize it. I've been based in New York for 20 years, and my brother's in Australia, but we're excited to have him over so you can visit his nephews as well, who you know are that at that age where his expertise is going to come in very, very handy. But look forward to having you all at the event if you can make it. So you can also meet these wonderful guest speakers as well. All right, so that's about it for this quick update. The website is straightteethnaturally.com. It's straightteethnaturally.com. By the time you see this, I think you'll be able to register online. If not, then simply just email us to be on the wait list for the VIP ticket if that is what you prefer. All right. So any questions, feel free to email us. This original recording with Professor John Mew was done back in 2023. So we're just inserting this update. We did that interview with Professor John just before the Sydney event. That was back in July 2023. So this year, very excited to have a new panel of guest speakers who will be giving their own individual presentations, and there'll be a panel as well. And hopefully you get to join them during the lunch or during the VIP reception, the dinner reception on the Friday, the 27th. All right, terrific. And that's all for now. Back to the recorded presentation. So before, let's introduce our esteemed guest, Professor John Mew from the UK. Professor John Mew is the creator of orthotropics, graduated in dentistry at the University College London, and then trained in orthodontic surgery. Seeking alternatives to facial surgery, he moved to the specialty of orthodontics in 1965. Since then, he has been pioneering and developing non-surgical methods of correcting unattractive vertical growth in children's faces using orthotropics, which he coined to encourage horizontal growth. A retired clinician, I beg your pardon. His principal research interests are the etiology of malocclusion and the guidance of facial growth. He was honored with life membership of the British Dental Association in 1999. Currently 94 years young, it is truly our great honor to have him speak tonight and our event in July. Bless you, John. How are you?
Hello, John.
All right, welcome, John. Simon, yeah, join in and have a chat with John.
What I was hoping to do is pick your brain on a couple of.
Can I butt in, Simon? To
Yes.
remind you, I'm quite deaf. You'll have to speak loudly, and if
Yes.
possible, I'd like to see your face on full screen as I lip read. That would be better. Thank you.
Okay, wonderful. Am I on full screen at the moment?
Fine.
Okay, so I wanted to pick your brain on a couple of questions because one of the things that I've learned in my journey with you is that as a budding early interventionist, our focus is almost entirely on transverse expansion, and particularly the maxilla. And one of the things that drew me to you was your concept that you could easily expand a maxilla and a mandible 10 millimeters or more. And it seemed like a completely foreign concept to me. And I asked you to be very clear with explaining the significance of this. And the thing that was most interesting for me was you said, Simon, don't get lost in transverse expansion. That's not the key to good growth, you said. It's important, but you said horizontal growth driven by posture and not mechanics like transverse expansion is the single most important thing that I can teach you. Would you elaborate a little bit on why so few of us understand the importance of posture in forward growth, horizontal, sagittal forward growth?
Yes, Simon, I don't remember saying that, but I still believe it as much now as I did then. It is horizontal growth which matters. Lateral growth is going to be very unstable unless the tongue corrects. But most people don't realize that the average human face is set back, their mid-face, that is, by about an inch. That is the average. Now, an inch is a huge amount. That is why you look around you, and most people have flat cheeks and big noses. Just ask yourself why. The whole of the middle section of the face is set back about an inch. It varies, but very few people are less than 10, 15 millimeters too far back. And you know that my emphasis recently has been on achieving 20 to 30 millimeters of forward growth. Now, you would know as well as I do that conventional orthodontics is quite unable to gain any forward growth. They gain a little with forward pull equipment of one sort or another, but otherwise, practically all fixed appliance treatment retracts the face, often only 1 or 2 millimeters, occasionally a little bit more, and not infrequently a lot more, and that really damages faces.
Yes, I think that we're so used to seeing faces that cannot house the entire dentition, that we have learned to accept that it's normal to have your wisdom teeth removed, that it's normal for our children to need to have braces. And we have confused normal with ideal, and common with acceptability. We don't have the tools available to encourage forward growth. So we've kind of fixated on the only thing that we have control over, which seems to be a little bit of transverse development of the maxilla. But even that's hindered by the fact that we can't actually develop the mandible in any degree. So despite all the wonderful expansion that people do in the maxilla in the early years, it's all lost by the time the child hits puberty because there's nothing to hold it. Your concept of tongue posture, lip posture, dental posture was something that was at odds with what we're taught at dental school. In dental school, the training focuses us on accepting freeway space as a normal. You know, that it is correct to have your teeth apart 4 to 8 millimeters, that your tongue rests comfortably on the floor of your mouth and your lips are lightly touching. Your concept of the tropic premise, where the lips should be in contact, the teeth should be in light or near contact, and the tongue should be fully on the premaxilla, the hard palate, and the soft palate simultaneously with the floor of the mouth for between 4 and 8 hours a day, was something that I had no concept of. Many people understand the significance of lip seal, but few understand why teeth need to be in light contact. And few people understand that the tongue not only has to contact the premaxilla, but it has to contact the full hard palate and the soft palate. But equally, that time is an important factor. How come you think, why is it that people don't understand the concept of posture, but they focus entirely on function?
An interesting point, Simon. The word you mentioned several times was normal. Normal is a very dangerous word. It is equivalent with average. Well, on average, our faces are back an inch. But that is all right, normal for us, but very abnormal for our primitive ancestors whose faces were, as I say, an inch further forward. The freeway space has created a lot of problems, largely because of the use of that word normal. Someone, I think it was just after the last World War, did research on the average posture of humans and found that there was a freeway space of 2 to 3, maybe 4 millimeters. So they then pronounced that that was normal. Yes, it is normal, but it's not correct. And that is the big difference. Everybody who leaves their teeth apart, the teeth naturally erupt. You may have heard of my tooth eruption mechanism. Every single individual tooth has its own eruption mechanism. They naturally erupt. If they come into contact with something, they'll stop erupting. If they are long-term in contact with something, they will intrude. It's fascinating to know that when you wake up in the morning, your face is longer because your teeth have erupted. But after each meal, your face is shorter because the teeth intrude. This is a constant activity which is necessary for all mammals. Every mammal's life depends on having perfect occlusion. If the teeth don't meet correctly, they will die. It doesn't apply to us. We live on soft food, which we can drink as easily as chew. But the essential problem, I think, is the use of that word natural.
We have stopped living a natural life for thousands of years. We have, I mean, the fact that you're in the United Kingdom and I'm in Australia and everyone else listening is dotted throughout the world tells us we're not living a natural life anymore. We live in a world that we have created with technology. And it's a wonderful world, but we don't want to throw the baby out with the bathwater. There's no reason why we can't keep a modern lifestyle, understand the significance of an earlier period within the evolution of mankind, and readopt the important components that kept our bodies physically more powerful. One thing that I noticed growing up over the last 50 years is that the focus of parents on their children's posture has gone from incredibly important part of culture to being non-existent. My grandparents, they were born in the 1800s, and they had my parents late, but they passed on the culture of a time when life was physically more demanding. And my parents passed on those concepts about posture to us. And because we were fortunate to have grandparents that lived a long time and we spent time with them, they spent time to share that historical, age-old knowledge that we need to stand upright. We need to sit upright. We can't drag our heels. We don't want to be looking at the ground. We want to have eyes towards the horizon. We want to have good core muscles in our belly and torso. And we need to keep our mouth shut and chew our food without talking, breathe through our nose so that we don't choke. And we need to digest this usually not particularly nutritious meal and savor it. Today, I see children with little bags of mushed juice, slurries and smoothies, and they slouch like rag dolls over their phones. They drag their heels. They look like they have spinal disease. And almost all of them watch TV with their mouth open. And I've noticed that the parents, who are usually in their early 30s, are doing the same. So they don't even notice that their children are behaving in a way that provides no stability to their skeletal growth. Now, you're of an era where you saw hardship, where if you were not physically robust, you wouldn't survive. It must be frustrating for you to see people today with such poor posture.
You're right, Simon. I brought my children up with that very simple philosophy. Hardship is good for you. You mentioned lifestyle, and you said that we should be able to overcome it or maybe bypass it. That, I think, is the problem. People do not appreciate how different our lifestyle is now from what it was. When a mother comes to me and says, John, how could I bring up my children so that they don't have these problems? I say to them, it's very simple. Sell your house and buy a cave, preferably in the top of a mountain. Don't eat anything unless you've killed it before or picked it, and never cook it. Not many people actually follow that advice, but that is a measure of the difference of our lifestyle now. In my belief, 3 aspects of lifestyle are the cause of almost all malnutrition. 1, living indoors. That is one which just does not occur to people. But all allergies come from allergens, and every bedroom is absolutely full of floating dust. And I have not the slightest doubt that is the main cause of all allergies, all the asthmas and problems that so many youngsters have these days. It is unnatural, but nobody wants to live out of doors. There is a modern solution there, Simon. Modern heat exchangers can also filter the air. So if you set them on a high enough setting, they will remove the dust and yet not lose much temperature. And I think before long, that is going to be standard for certainly every bedroom, but I would think probably for every house. It'll take a long time because, of course, the power consumption will be enormous. But in our drift from our, how shall I say, a civilized society, we've also forgotten about hard or soft food. Now, our ancestors ate really hard food. So hard was the food that the cusps of their teeth had worn flat within 2.5 years of eruption. That's not long. By the time they were 60, the first molars were usually worn down to gum level. That is what we see in primitive skulls. And yet, the only time you see worn cusps now are in bruxers, and they're considered pathological. I'm sure both you and your brother have all your cusps probably in full height, but that's because you've lived on slops all your life, as indeed I have. And I couldn't possibly chew the food that they used to then. The final cause of malocclusion from lifestyle is the lack of breastfeeding. People think that is normal. They say, well, we can feed with a bottle, why worry? But what I think very, very few people realize is that the way you learn to swallow correctly is by firmly pressing on the breast to get the milk out. Most mothers think that suckling involves sucking. It does not. People should never swallow by sucking, and yet over 90% of people in this world do just that. They suck when they swallow. That collapses the maxilla, and which is why 90% of us have narrow maxillae. The maxilla should be 44 millimeters or maybe more. The average maxillary width in British subjects is 33.5 millimeters. There is no way you can find room for 32 teeth in an arch which is that narrow.
Agreed, definitely. This is very clearly shown through research. So, John, there's a lot of our guests today who are participating in, they have a lot of questions, and just wondered if it would be okay if we had them ask you some of those questions and perhaps get some answers.
So there's RT Jane. I think I've unmuted you. So I think you raised your hand. Do you want to turn on your microphone and ask your question directly to Simon, or type it in? Are you there, RT?
Maybe just read it out.
You haven't submitted. You raised your hand, so I'm assuming you have a question. You could type it in, or you can. I've unmuted you, so you can talk if you'd like. If that was a mistake, that's not a problem.
Can you hear me?
Oh, yes, Artie, please go ahead.
Hi. So, hi, Simon. Obviously,
Hello.
I'm based in the UK, and I just wanted to understand how easy is it to get these appliances made in the UK, you know, with the different labs here, and especially because I did your 2-day course, I'm still working through that. But how easy is it for, you know, an orthodontist to dive into these kind of appliances based on the experiences? Because I've tried the other ones. I went to Dr. Truitt's course. I did a lot of appliances that he suggested, like three-way Schwartz and some other appliances that he was recommending. They were a little complicated for the mandibular arch. It involved a button and some wires. whereas yours look very good, and especially the Wong, and Dr. Muse, who I greatly admire. But I just wondered, is it only specific labs here? And if we wanted to start doing these cases from an early age, because I also recommend from around 6-year-olds for our children at our practice, even earlier if we can, with some myofunctional appliances. But how easy is it to get it here in the UK, the design?
Well, there's a couple of ways that we can help you with that. Obviously, Enrico can help if you are prepared to send STL files.
Yeah.
It can be shipped over. But we've also, Enrico has also trained technicians in Poland, and he's trained technicians in Lithuania. So
Great.
obviously it's a little bit easier for you to ship things from
Shipping
Europe.
there, yeah. So nothing in the UK, or is Dr. Muse, like, does he have something here?
Yeah, and then, Mike Mew has their lab as well. So obviously.
And would you get your appliance there as well? Like, they are trained to do the Wong widget as well, like the lower arm?
No, they tend to use their own appliances.
Yeah,
but-
because I think I took my daughter to him, and they
Yeah,
did show some bio blocks and stuff, but
Yeah.
I
But
mean,
my
I'm-
specific appliances, at the moment, we only have people in Poland and
or
Lithuania
in Australia.
who are able to provide that, or we can ship them out here from Australia.
Actually, Enrico's here. Look, Enrico,
Yeah.
what's the turnaround time,
Yeah.
shipped to the UK? We do some.
It's 12 working days.
12 working days. Okay. And shipping cost obviously would be just added on, because we can send the STL files. That's not a problem.
Yeah, I do it for 12, 13 different countries. So it's
Okay.
all in Europe.
That's good to
But
know.
as long as I get the STL file,
Yeah.
and let Simon do the design for you if you want, right?
Yeah. Yeah.
Which is very, very good to do.
Yeah.
And you'll get them and you won't have any issues.
And how easy is it to, like, as with the lower expansion cases or upper or lower, which I was doing, I mean, the patient is just turning the key, obviously, at the recommended rate. Is there much adjustments and stuff for these ones? Like, do we need to do quite?
Look, there's always technical sides of it, whether it's
Yeah.
braces, whether it's
Yeah.
Invisalign, whether it's even if it's a my brace, right? You have to,
Yeah, all of
you have to
them.
pull the scissors out and trim and do adjustments. So that's some of the things that we help you with in the advanced program and in the mentorship program.
Okay.
Many people can kind of work their way through the process if they've, if you've used Schwartz appliances before, for example,
Yeah.
then you won't have any issues
This is a
because
lot.
they're the same issues. But if you want assistance, then we have
More of a training.
we have programs that provide whatever level of assistance that you want. If you just want theory, there's theory only.
Yeah,
If
basically mainly like just the theory, like how it's different to a Schwartz, and like just the literature on that, and basically
yeah, for sure.
I
So
like
we
any
have,
new thing, and the
Yeah, we-
recommended turning rate, and how
yeah,
everything
that's
can be
all
different.
that's all covered in the.
That's all in there. Yeah, postural.
yeah.
I'm just still working through the course. It's quite a lot of information.
Yes, it's not,
Life takes over. Yeah, but it's those things are good. But I just thought I'll ask you that, how easy is it to get these appliances? Because they look really
Yeah.
good. Yep.
wonderful.
All right. Thank you.
So
Thank
just
you, Aarti.
Artie, just
Wonderful.
email us.
Yeah, sure.
info@straightteethnaturally.com and mention the appliances, and we'll connect you with Enrico and talk about if you want Simon to get involved with the design, what's that?
Yeah, maybe sending few cases before we. Yeah, that'll be great. Thank you.
Thanks, Artie. All right,
Thank you.
appreciate it. We've got a bunch of other questions, so let's power through these. If I may read them out, just go through the order of as they came in. We have. It's best if you can type your questions in the Q&A box and not in the general chat box. But let me just quickly go through. Eric Davies, welcome, Eric. Good to hear from you. What exact screw are you using for the lower Wong widget and 10 rate? Says Eric.
Yeah, that's Eric, you've done the 2-day introduction. It's actually in the handout manual.
Okay, if you have trouble finding that, just email us and we'll dig it up for you, Eric. Part of
We use fluorescent skeletal sagittal screws, and we use dentarum skeletal sagittal screws.
Very simple.
Yeah, so that it's all in the handouts.
In the download section. So Eric, if you're not sure where that is, just send us an email and we'll give you some guidance on that. We have very comprehensive practice templates, downloads, etc. as part of the 2-day intro. Sometimes people forget to download them, and that's why we just got to remind everyone it is all there. All right. The question from Lydia Lozanova. Excuse my pronunciation. Thank you, Professor Joe. I'll meet you in September. Fantastic. Vazuki has a question. How do you like to assess the child's level of growth and potential for further growth?
My patient base is between 4 and 9 years of age. So I don't really need to assess the growth because I know they've got half a decade of growth ahead of them. So, like if you pick old patients, then you have to be very particular about evaluating growth. But my program is called early intervention, which means that we're treating before 10. And if you treat before 10, everyone has growth. A lot of it. Enough for you to work with.
Okay, next question. Raman says, are there any trained technicians in the US? They trained, I think Enrico, you haven't trained specifically in the US, so we are still servicing. We're still servicing.
I'm going to answer this question to everyone. You can use any lab you want. I mean, we can't force you to use a lab, but the amount of work that Simon and I have done on this to get the great appliance that's out there that everybody loves, you can train people, but you can't train them in a week, 2 weeks. Okay, you're talking at least a 90-day training program, which is very hard to do for people. So, I mean, I don't want to be the one to say, "Oh my God, send me all your." No, that's not it.
Actually, Enrico, in the past we would say, yeah, you could try to replicate it, but at the end of the day, we want you guys to get the results. We have.
You know what happens? I've told you this and Simon so many times. Yeah, everybody calls me. It's not working. Why this guy did it like this? This guy. So, and then I end up making an appliance for them. And then, so it's not because we're special. It's we worked very hard at it. And you need to put the wires in a certain mode. The wires have to be a certain shape. The clasps have to be a certain length. There's a lot of little intricate things that you need to do to get it right, or else it's not going to work.
Absolutely.
Back to the Schwartz.
And we've figured out the shipping from all around the world.
Oh, the shipping is easy. DHL, you're getting the thing.
Yeah.
I mean, Simon, we do jobs for that lovely lady in Cambodia, for God's sake.
Exactly.
She doesn't even have a scanner. She sends models to me, and I still get them back in 2.5 days because I have to wait for the models to come. The rest of the world, like people from New York, all the Midwest send me work and stuff.
Exactly.
I get them in 5 minutes.
Yeah,
So,
we live in a world today where every one of us on this call is from a different corner of the world.
Yeah.
So with that technology means that you want something from Melbourne, Australia, sent to you in
easy.
Arkansas, it's there.
Doing
Yeah.
Just try out Enrico, right? And if you can replicate it with your local lab, fantastic.
By all means. By all means.
Keep on ordering from, Enrico. The Aussie dollar has dropped a lot. It's cheap in the US. Anyway, let's move on to the next question.
Next question.
Okay, Vazuki has another question. What analysis are good to evaluate discrepancy?
We encourage you to use whatever analysis that you want because they will tell you what the skeletal classification is, and that's basically all you need. You need to know the vertical dimensions, the y-axis, FMA, and you want to know what your skeletal relationship is relative to the cranial base. So you just need to know, are they developing vertically? Are they developing with retrusion? You use the normal orthodontic analysis. Just use whatever you like. the message is always the same when it comes to vertical growth dimensions, and vertical is the most important component for you to use as a flag of warning, so to speak. Right? Horizontal growers are fairly easy to treat. It's the vertical growers that create all the dramas, and all the analysis are very similar in their defining of the vertical dimension, and you just focus on whether it's outside of the norm, and if it is, then just beware. Okay, next question.
Next question. Christoph Bottini. Hi, what's your experience of expanding arches with aligners in the pre-teens years? Thank you.
0. Never done an aligner in a preteen. Okay, next.
Okay, sorry. All right. Heidi, other than the GoPex book, what other myofunctional therapy do you include in your program?
I don't use anything other than what we have in GoPex book. Although in the advanced program, I will talk to you about GoFex, which is the finishing exercises that we teach for tongue control. So the exercises that I have are half dozen or so exercises, and that's it. That's all I use. I'm not here to eliminate dysfunction. When you are focused on resolving dysfunction, there are literally hundreds of exercises that you need to be able to solve dysfunction. What I'm focusing on is to improve posture. And to improve posture, literally one handful of exercises is all you need. Okay, next.
Okay. Implemented consistently. All right, next question for Adnan Anwar. We've just discussed mandibular growth in children, for mandibular growth in adults. What possible devices are there? There are, of course, surgical options.
Yeah, surgery is the only thing that you can use predictably within the standard of care for adults if you want mandibular skeletal change.
Okay, just so you know, the Postural Orthodontics program, I get asked it all the time. It's only for children. Simon only starts treating children as young as 3 and max around 10-ish, right? Case by case, but ideally before 8. 8 is too late, as they kind of say. So if it's teenagers and blah, 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 it's not our area. It's not where the evidence and literature has shown. So that's why we stay clear of anything that's not evidence-based. There's people being sued in America for doing expansion work on adults, as you probably heard about recently, right? That's not where we go, right? Anyway, Raman, are there any trained labs in the US? Okay, no, we've already answered that question. One more from, Vivian Tran. V Tran. Yes, hi, Simon. What is the advantage of using removable appliances over a 2x4 braces early intervention expansion with coils taught by EODO, which is Dr. Derek Mahoney's course? P.S. I do love your Wong stage 1.
Well, it depends if you want to move teeth or you want to change the dimension of the alveolar bone. So if you want to affect skeletal change, then you need a lot of coverage and pressure on the bone. When you put braces on teeth, or you're moving our teeth.
All right, terrific. Thanks for that question, Vivian.
So, Kian, Enrico and I will sign off. But,
Okay.
Why don't you, go through the offers and explain people how they might.
Okay. All right, sure. All right, so if everyone wants to stay behind, I'll answer any questions regarding the event. Enrico, thank you for joining us, buddy. Simon, nice. Thanks, everyone. John, thanks, everyone. So we've still got 60 odd people here, so it means that there's some questions, that administrative questions in relation to the event. Otherwise, thank you for joining us tonight. All right, once again, a final mention of the upcoming event this year. This will be September 27th, 28th, Friday, Saturday, September 2024. At the Doubletree by Hilton Newark Airport, 7 minutes from the Newark International Airport in New Jersey. There's a hop, skip, and a jump, 20-minute, 25-minute Uber drive to Midtown Manhattan if you want to hang out in Manhattan, perhaps on the Sunday or Saturday night. before you fly back to wherever. And do join us, my brother, for 2 days, along with guest speakers, Dr. Amanda Wilson, an orthodontist, Dr. Rinda Singh, who'll be live streaming in. Amanda will be there in person. Kevin Boyd, pediatric dentist, will be there in person. And Enrico Di Giovanni will be there in person, founder of 8 Point Dental Lab. So do check out our website, straightteethnaturally.com, and register. And if we haven't, we haven't even launched officially the website. It's still under construction, finalizing a few things. As you can see, purchase link has been deactivated. So just email us at info@straightteethnaturally.com. If you watch this before these links are up, these buttons are up, it should be up in a week or so, but in case you are watching this before that, send us an email if interested. And also for accompanying staff, do email us the details of who's coming to get the 50% discount on your team. Yeah, that's about it. We hope to see you at the beautiful Doubletree Hilton Newark Airport in September. All right, take care. Thank you.